Welcome back to The Race. I'm Chris Stewart, and we're here in the Bay Area this week talking about healthcare. This is considered one of the healthiest parts of the United States, but we also found that it's an area where it does deal with a lot of the same issues other communities across the country do, and that's the fight to make sure everyone has access to healthy foods. While San Francisco is often ranked near the top when it comes to being healthy, it's a different story across the Bay Bridge in West Oakland. It's considered a food desert. The people here don't have easy access to fresh food and groceries at affordable prices. Instead, corner stores make up much of their food options, and those just aren't the healthiest.
Because they see it's coming.
Ram Ahmadi is leading the effort to change that. He's worked for years to make Community Foods Market a reality. He took us to the West Oakland lot where he's building it. It's an independent grocery store that will sell fresh food at cheaper prices than many chains. He says this project, it's not about making a profit. It's about the lasting, healthy impact it can have on the people of West Oakland.
This idea that particularly independent grocers that are really committed to being of service to their neighborhoods that they're typically a part of can go well beyond just being a retail operator to really engage in their communities and providing more value to their communities.
Brahm says when Community Foods Market opens in January, much of the food will come from local farms and much of the employees will come right from this community. Now, when we do talk about the issue of food, you have to talk about the issue of childhood obesity. Recent numbers from the CDC show 1 in 5 school-aged children in America are considered obese. Annie Taylor talking to a family that's trying to raise healthy children and asking whether the government should play a role in that.
This is what an average weeknight looks like for the Kohler family.
Ella, your food's ready.
Racing to make a quick but healthy dinner for all 3 kids.
Most dinners are
You want this?
15 minutes long.
Then wrangling them up to head out to their after-school sports. But it's when the kids are off at school, Steve and Nikki hope their kids stay healthy.
Hopefully good habits and when they're on their own.
It's a big issue.
But Dr. Scott Kahan, who sits on the board of directors for the Obesity Action Coalition, says it's not just the Kohlers' responsibility to keep their kids healthy. Local and state governments can make a difference.
For example, local policies that increase the opportunities for physical activity during the school day have started to come into place, and I think that's a good area for governments to work on.
The Kohler family agrees.
Having an active lifestyle, I feel, helps them in school because they are sitting for long periods of time.
According to the CDC, only 29% of high school students attended PE classes in 2015. Family and consumer science classes, once known as home ec, are dwindling in schools, mainly due to problems finding qualified teachers.
Parents can take it on themselves to learn more about healthy eating and activity and come up with creative ways to help their kids to be just a little bit healthier.
When it comes to school lunches, 50% of kids' daily caloric intake come from them, and 31 million kids eat them every day, according to Kaiser Permanente. That's why there are guidelines in place to keep them healthy.
You want some more or what?
The Kohler family feels lucky to be able to make their kids healthy lunches.
We know what's going into their lunchbox and what they're going to eat every day.
We need to stop pointing the finger, Dr. Kahan says, and realize parents, schools, state and local governments all play a role in a child's life.
We help everyone to pull together so that we can all lead healthier and happier lives.
Okay, all done?
For The Race, I'm Annie Taylor.
And part of the reason that San Francisco was named America's healthiest city is because of the bike paths you see here, these green spaces. Such a key part when we talk about healthcare and how people stay healthy. Now, another big part of that is the work the government's doing, looking into diseases and disorders, trying to find cures to help people live longer and healthier lives. Corey Rangel taking us inside the National Institutes of Health with a look at the work they're doing there.
This is the largest clinical research hospital in the country. It's part of the National Institutes of Health, a government-run medical research agency. NIH has about 7,000 scientists who work in research laboratories looking for new ways to improve health and save lives.
This is a tumor that's actually pretty large.
Next year, more than $39 billion in taxpayer dollars will be spent here to find treatments and cures for the biggest health issues in the country, including heart disease, cancer, and Alzheimer's. Right now, there are about 1,600 research studies in progress. Dr. Larissa Corday is trying to help find the latest breakthrough in breast cancer, the second leading cause of cancer death among women.
How do we best diagnose cancers? How do we pick them up at the earliest possible stage so that the likelihood of dying from that cancer is lower? And how do we prevent cancers from occurring in the first place?
Dr. Corday says the work done here has a proven track record.
Women with HER2-positive breast cancer now have numerous effective therapies and tend to live longer than they did before those drugs were evaluated and came to the market. And our research has been, involved all along the way.
With each new study, doctors continue to learn more and hope the next discovery will help save more lives. For The Race, I'm Corey Rangel.
When the race continues from America's healthiest city, we're going to go 2,400 miles to the Midwest, to one of America's most unhealthy cities, the problems they have, and we're also taking a look at how its government's trying to fix it.